Healthcare is a word that will always have people feeling conflicted, no matter where you're based, your income, lineage, or gender. We find ourselves needing it at some point in our lives. It's an essential, yet countries across the world grapple with different systems in issuing this service, from health insurance, funding, and just basic government-backed structures. On our radar in this production is the England-based National Health Service. United Kingdom Prime Minister Sir Keir Starmer has just announced the abolishment of the service that was introduced to the country 12 years ago by the previous government. The abolishment of the service is in an effort to bring management of the National Health Service back into democratic control, which would free up money for doctors, nurses, and to reduce unnecessary regulation to help speed up improvements in the health service amid frustrations about the pace of change. And you are at the right place to understand it all. Welcome to Engaging Productory, where we issue engaging summarized global political productions. We're thankful for your time. See, the Conservative Party and Liberal Democrat coalition government, led by Prime Minister David Cameron on the right and Deputy Prime Minister Nick Clegg on the left, established in 2010, had introduced the service as part of a series of reforms under the Health and Social Care Act 2012 that aimed to bring about a more modern and efficient framework for issuing healthcare to citizens. The NHS was part of an effort to rid of political interference in frontline services and overwhelming responsibility for the health of citizens from the Department of Health and Social Care, as well as the Secretary of State for Health. This system notably abolished the system of primary care trusts and strategic health authorities, enabling a way for easier means to issue consistency and accountability for when health services were offered throughout England. In simpler terms, the Department of Health and Social Care, or DHSC, takes its government-issued funding, of which is £200.5 billion for 2025 and 2026, and creates the overall policy direction, strategic priorities, and budget allocations to NHS England, a separate centralised administrative body overseen by officials and managers that are informed on what they should prioritise. Of the £200.5 billion funding given to the Department of Health and Social Care, £192 billion of that money was allocated for NHS England. Responsibility was on the NHS officials to calculate and allocate which departments the resources need to go to without too many middlemen and admin to give all citizens the best healthcare possible. The Department of Health and Social Care isn't the only entity that has major influence on NHS England for delivering efficient high-quality care. The National Institute for Health and Care Excellence, which is under the DHSC, provides recommendation and guidelines for treatments such as medications, medical devices, performance metrics, clinical guidelines, cost analysis, and preventative healthcare. With the information I've provided in regard to how both the DHSC as well as the National Institute for Health and Care Excellence assist NHS England, you start to see this large bundle of systems and people that idealistically looks like a great initiative, but realistically isn't working like it should. Unfortunately, like every newly introduced system, the NHS has experienced its fair share of ups and downs. Let's start off with the stop of the primary care trusts. This was succeeded by clinical commissioning groups, which were supposed to improve the efficiency of healthcare, but instead added more complications like regulations, paperwork, and management. Critics of the commissioning groups said that this diminished patient-focused care. On the topic of care, do you recall when I mentioned issuing consistency and accountability for when health services were offered throughout England? The consistency part seems as though it was for promotion, because when NHS came into effect, healthcare service quality per region differentiated over the years, stemming from overworked healthcare professionals due to staff shortages caused by strict budgets. This underfunding caused a domino effect on varying regional outdated equipment, overcrowded facilities, inadequate communication for service, and prolonged waiting times. Health ministers in the previous Conservative government oftentimes visibly display their disappointment and irritation over the fact that they weren't in control of the everyday healthcare services. The accountability aspect of the statements I made earlier is exactly what Keir Starmer and the current Labour government is doing. In his own words, by refocusing on cutting waiting times at your hospital. Health Secretary Wes Streeting seconds this. He wants closer governmental control of health. He also claims that NHS England was a disastrous reorganisation that led to the longest waiting times, lowest patient satisfaction, and most expensive NHS in history. Secretary Wes further stated that when money is so tight, we can't justify such a complex bureaucracy with two organisations doing the same jobs. We need more doers and fewer checkers, which is why I'm devolving resources and responsibilities to the NHS frontline. So Keir Starmer also added, amongst the reasons we are abolishing it is because of the duplication. We're duplicating things that could be done once. Abolishing the service could free up that money to put it where it needs to be, which is the front line. One of the primary causes of this entire NHS saga is the taxpayer contribution to this institution, yet healthcare isn't controlled and overseen by central government, but is instead controlled by managers on behalf of the government, which fuels citizens' infuriation for the unpredictable service. Sources in the Labour government support the belief that disbanding NHS England will keep £500 million in the government's budget. The reforms the Labour government is seeking to introduce aren't going to impact anybody's access to the National Health Service. It will still compensate for all the services it does at the point of use for free. It has, unfortunately, been announced that about 9,000 administrative roles will be removed from NHS England and the Department of Health and Social Care in an effort to halve all the positions in the two organisations. Some seem not to think so. According to Sky News, under the category of devastating for staff, Thea Stone, head of the Nuffield Trust, a charitable trust which aims to improve healthcare in the UK, said the announcement will be devastating for staff at all levels of NHS England. She added it makes sense to remove the duplication and bureaucracy that exists currently, but warned we must remain mindful of the human cost of this decision. This was followed by a statement by a think tank called the Health Foundation, which stated that this was a watershed moment in how the NHS is governed and managed, and there is logic in a decision to bring the NHS and government closer together. The think tank added that scrapping NHS England will cause disruption and divert time and energy of senior leaders at a time when attention should be focused on improving care for patients. The think tank further said reforming NHS bureaucracy is not the same as reforming patient care, and government must be careful that these changes don't get in the way. Critics have previously shared sentiments that NHS England standing on its own has made introducing reforms or improvements to the system challenging. The Prime Minister supports the belief that disassembling and rebuilding the management structures of National Health Service England will free systems for data management, training, and money for the already mentioned frontline services such as doctors, nurses, and other medical professionals. All of this will seize the duplications, non-functioning management, and admin loads the previous government caused in the health service, which Sir Keir Starmer believes is the cause of the inconsistency in healthcare. According to BBC News, supporters have been stating that if you move NHS to local level and nearer to patients, it will be health leaders who are more attuned to the needs of patients in the area making those calls. They will know what local populations need and where the weaknesses are, and that, in theory, could improve services for patients in different parts of the country. This matter has gotten so substantial that NHS Chief Executive Officer Amanda Pritchard will be resigning at the end of March 2025, and a portion of members in her team will be following her out the door. A new team of officials, led by incoming transition Chief Executive of NHS England, Sir James Mackey, will be overseeing the 2-year transition of returning NHS England to the Department of Health and Social Care. There is also an incoming NHS Chair, Dr. Penny Dash, who will be assisting to bring together the two organisations to lower the duplication and streamline functions. Sir James also shared a statement which read that he's aware that this announcement will unsettle staff, but it will also bring welcome clarity by tackling the significant challenges ahead. Health Secretary Wes Streeting has stated that he will aim to generate £100 million in savings. According to Sky News, the Prime Minister's spokesperson mentioned that the implementation of artificial intelligence and digitizations will work to free up £45 billion in savings. This will be a sizable shift for England's healthcare and its services. The future for these services still remains a bit vivid. NHS England has 15,300 employees, and the Department of Health and Social Care has 3,300 employees in its ministerial department that develops and implements legislation and policies. Like I mentioned, 9,000 civil servant jobs will be lost, which nobody wants to hear or experience. According to labour.org.uk, the Labour government plans on cutting NHS waiting times by adding 40,000 more appointments every week. They plan on doubling the number of cancer scanners to detect it early and provide treatment. They will be introducing a new dentistry rescue plan to improve access to dental care. They plan on recruiting 8,500 additional mental health staff to boost the services. Lastly, family doctors will be brought back into the system. From what we've been informed by the government, this seems like an optimistic approach to resolving England's health services issue. Lower the admin, lower the amount of managers and overseers, reposition required people and systems to ease vigilance for optimal service, and lastly restructure funding and increase budget savings to issue efficient service for doctors, nurses, staff, equipment and citizens. Do we think these changes were needed? I'm a firm believer in not celebrating something until we reach the finish line. This race has just begun. Is this a step in the right direction? Any step seems like a step in the right direction, so long it's looking to improve something, or else would remain undecided and stagnant. Only time will truly tell if this works out. What do you think? We value your opinion. Comment down below. There should be videos up on your screen. Feel free to pick the next one you'd like to watch, or browse our vast catalogue for something else you may like. Thank you for watching. Cheers everybody.